If your Shih Tzu has suddenly changed personality in the past few days, more irritable, less playful, or following you like a shadow, do not assume it is just mood. In most cases, I have seen, that is, the body signaling pain before illness becomes obvious. I have worked with Shih Tzus for more than 10 years. I can say this clearly. This breed is so gentle that it tolerates discomfort too well. And that is exactly the problem. Shih Tzus are a brachycephalic breed with short muzzles, small jaws, crowded teeth, and delicate joints. Those structural traits make them prone to periodontal disease, ear infections, allergic skin disease, and early joint degeneration. But because a dog's survival instinct is to mask weakness, they do not announce pain the way humans expect. They change behavior. When a normally sweet Shih Tzu suddenly growls softly when you touch its back, that is not attitude. It may be mild disc inflammation or muscular pain. When your dog pulls away, when you touch its face, I immediately think about a dental abscess extremely common in this breed because of jaw crowding. Many owners only notice when the breath becomes unbearable. Now let us talk about sleep. An adult dog sleeps around 14 hours per day on average. But if your Shih Tzu suddenly sleeps 18 to 20 hours, ignores favorite toys, and shows no interest in interaction, that is not being calmer. That is the body conserving energy to fight inflammation or infection. When the immune system is activated, the brain shifts behavior toward rest. Biology does not consult your emotions. Another sign many people overlook: hiding under the bed. Shih Tzus are highly people-oriented. If your dog suddenly prefers dark corners and avoids interaction, that is an ancestral survival response. In the wild, a sick animal isolates itself to avoid attracting predators. That behavior remains encoded in their genetic survival patterns. After watching this, I want you to think back over the past week. Was there a small change you reassured yourself about by saying, "It is probably nothing"? Veterinary behavioral research shows that sudden behavioral change is often one of the earliest indicators of internal medical disease. Before vomiting, before fever, before abnormal blood tests. With Shih Tzus, I pay close attention to 4 behavioral shifts. First, a change in temperament when a specific area of the body is touched. Second, decreased social interaction or avoidance of light. Third, a significant increase in sleep compared to previous patterns. Fourth, unusual clinginess at night. Clinginess may look adorable, but mild arthritis or low-grade internal pain often intensifies at night when there are fewer distractions. Your dog may press closer to you, seeking security. You see affection. The body is seeking comfort from discomfort. Here is what matters most. Never separate behavior from physiology. A Shih Tzu does not randomly change. The nervous system is always responding to a cause. You do not need to panic over one quiet day. But if behavioral changes persist beyond 24 to 48 hours, or if they appear alongside reduced appetite, altered breathing, or stronger mouth odor, that is, when closer evaluation becomes necessary. Think of yourself as someone reading biological data, not guessing emotions. In the next part, I will explain the most vulnerable system in the Shih Tzu, the respiratory and cardiovascular system. Because in a brachycephalic breed, noisy breathing is not always cute. Sometimes it is a warning we have heard so often that we stopped recognizing it. If your Shih Tzu breathes loudly, snores, or pants more than other dogs, you may have been told it is normal for the breed. That sentence has delayed more diagnoses than almost anything else I hear in clinic. Let us be clear. Shih Tzus are brachycephalic. That means their skull is shortened. but the soft tissues inside the airway are not proportionally reduced. The result is narrower nasal passages, an elongated soft palate, and increased airway resistance. Air does not flow as smoothly as it should. And when airflow is compromised, every other system feels it. A healthy resting dog typically breathes between 15 and 30 breaths per minute. That is, at complete rest. In a cool room, with no recent activity. If your Shih Tzu is lying down calmly and breathing much faster than that, something is forcing the body to compensate. It may be pain. It may be heart disease. It may be early respiratory compromise. Panting has a purpose. Dogs pant to regulate temperature, but heavy panting in a cool environment without exercise is not temperature control. It is a stress response. When the body perceives oxygen imbalance, fluid in the lungs, hormonal dysregulation such as Cushing's disease, or cardiovascular strain, respiration increases. Here is what makes this breed more vulnerable. Because the muzzle is short, even a small amount of extra weight increases pressure on the chest wall and upper airway. 1 or 2 extra pounds on a small Shih Tzu is not cosmetic. It can significantly reduce respiratory efficiency. Fat accumulation around the neck and thorax increases the work of breathing. Over time, that chronic strain can stress the heart. Pay attention to these changes. If your Shih Tzu tires quickly when climbing stairs, even though it used to run up easily, do not dismiss that as aging. It may be reduced oxygen delivery or early cardiac weakness. If the tongue or gums look pale or slightly bluish during exertion, that suggests reduced oxygen saturation. Oxygen should make tissues pink. When color shifts, physiology is shifting. If breathing becomes louder, harsher, or more labored than your dog's usual baseline, that is not personality. That is airflow resistance. There is also a dental connection most people miss: chronic periodontal disease, which is extremely common in Shih Tzus due to jaw crowding. Does not stay in the mouth. Oral bacteria can enter the bloodstream and contribute to systemic inflammation, including effects on the heart valves. A dog with severe dental disease and new exercise intolerance should never be evaluated only for fitness. The mouth and the heart are biologically connected. Another subtle sign: increased night restlessness combined with faster breathing while lying down. That can be an early indicator of fluid accumulation related to heart disease. Many owners first notice that their dog cannot get comfortable, shifts positions repeatedly, or sleeps with the neck extended to open the airway. I want you to understand something important. Not every noisy Shih Tzu is in crisis, but every Shih Tzu has a structurally vulnerable airway. That means your baseline for normal must be precise. You should know your dog's usual breathing rhythm, recovery time after mild activity, and tolerance to heat. Heat regulation in brachycephalic breeds is less efficient. They cannot dissipate heat as effectively through panting because airflow is already restricted. That is why overheating can occur faster in this breed, even indoors. So here is your practical framework. Count resting breaths occasionally when your dog is fully asleep. Learn what normal looks like for your individual dog. Notice changes in stamina, not just dramatic collapse. Watch gum color during mild exertion. Maintain lean body condition. Address dental disease early, not when odor becomes overwhelming. With Shih Tzus, respiratory and cardiovascular health are not secondary concerns. They are central pillars of longevity. In the next part, we will move deeper inside the body into metabolism and organ function, because sometimes the quietest changes in water intake, appetite, or coat condition are the earliest signs that internal systems are losing balance. If your Shih Tzu's water bowl is empty twice as fast as usual, that is not just thirst. That is physiology shifting. This is the part most owners miss because the changes look small. A little more drinking, one accident in the house, slightly thinner fur, eating a bit less. Nothing dramatic. But metabolism rarely collapses in one loud moment. It drifts first. Let us start with water intake. In a stable adult dog, drinking patterns are relatively consistent from day to day. When a Shih Tzu suddenly begins drinking significantly more and urinating more frequently, especially if this persists beyond a couple of days, I immediately think about endocrine and renal function. Diabetes mellitus is one possibility. When blood glucose remains elevated, the kidneys attempt to remove excess sugar through urine. Water follows glucose. The result is increased urination, which then drives increased thirst. Owners often describe it as drinking like never before. Chronic kidney disease presents differently but overlaps. As kidney filtration declines, the body loses the ability to concentrate urine properly. The dog urinates more diluted fluid and compensates by drinking more. Many small breeds, including Shih Tzus, are predisposed to kidney issues later in life. Cushing's disease, a disorder of excessive cortisol production, also commonly causes increased drinking and urination. Cortisol affects fluid balance and metabolism. When hormone regulation shifts, behavior shifts with it. Now, let us talk about appetite. A healthy Shih Tzu is usually enthusiastic about food. If your dog refuses meals for more than 24 hours, it is not simply pickiness. When caloric intake drops abruptly, the body begins mobilizing stored energy. Initially, glycogen is used, then fat. If the deficit continues, muscle tissue is broken down to maintain blood glucose. Loss of appetite can be linked to dental pain, gastrointestinal inflammation, liver dysfunction, infection, or systemic disease. With this breed's dental vulnerability, oral pain is especially common. Many dogs continue to approach the bowl but hesitate to chew. Owners misread that as mood. It is often pain. Coat and skin are another metabolic window. Shih Tzus are known for their long, dense coat. When you begin to see thinning fur, symmetrical hair loss along the flanks, or changes in coat texture. Think endocrine system. Hypothyroidism slows metabolic rate and can cause lethargy, weight gain, and coat deterioration. Cushing's disease can produce thinning skin and hair loss patterns. The body prioritizes vital organs over cosmetic structures. When hormones are imbalanced or internal stress is high, energy is redirected away from hair growth and skin maintenance. What you see on the surface is a reflection of internal regulation. Now, consider body weight. Sudden weight loss without intentional diet change is never neutral. It can signal malabsorption, chronic infection, cancer, or uncontrolled diabetes. Conversely, gradual weight gain, despite stable food intake, may indicate reduced activity from pain or endocrine imbalance. And then there are lumps. If you are petting your Shih Tzu and feel a mass that was not there before, do not assume it is harmless. Some lumps are benign lipomas. Others are mast cell tumors or other malignancies. Small breeds live long lives, which increases cumulative cancer risk with age. Early evaluation is the difference between monitoring and crisis. I want you to see the pattern. Metabolic disease does not shout. It whispers through routine. A bowl empties faster. The coat changes texture. The scale shifts slightly. Appetite becomes inconsistent. Energy feels subtly different. These are not personality traits. They are biochemical shifts. Your role is not to diagnose at home. Your role is to notice deviation from baseline. Every Shih Tzu has its own metabolic rhythm. When that rhythm changes without explanation and persists, that is your signal to investigate. In the final part, we will discuss the nervous system and true emergency signs, the moments when hesitation is dangerous and immediate action protects the life in front of you. If your Shih Tzu suddenly walks as if the floor is moving beneath them, do not wait to see if it passes. When coordination changes abruptly, time matters. This final section is about the nervous system and true emergency signals, the moments when hesitation can cost a life. Let us begin with balance. If your dog stumbles, leans to one side, falls over, or walks in tight circles repeatedly, that is not clumsiness. In small breeds like the Shih Tzu, sudden loss of coordination may indicate vestibular disease, stroke, inner ear infection, toxin exposure, or even a brain mass. The brain controls spatial awareness and movement precision. When that control is disrupted, the body cannot compensate quietly. A dog that tilts its head persistently, especially with rapid eye movements, is showing you a neurological imbalance. A dog that circles only in one direction may have a lesion affecting one hemisphere of the brain. These are not behaviors to monitor for days. They require immediate evaluation. Now, consider staring episodes. If your Shih Tzu freezes mid-activity and stares into space for extended periods, unresponsive to your voice, that may be partial seizure activity or cognitive dysfunction. In senior dogs, degenerative brain changes can appear gradually. In younger dogs, abrupt mental absence is more concerning and must be investigated urgently. Then there is pain posture. If your dog stretches forward with the front legs extended and hindquarters raised, holding the position rigidly, that can indicate abdominal pain. This posture is often associated with pancreatitis or gastrointestinal inflammation. Small breeds are particularly prone to pancreatitis, especially if exposed to high-fat foods. Now, let us speak about gums and color. Healthy gums should be pink and moist. If they become pale or white, that can indicate shock or blood loss. If they turn bluish or gray, oxygen levels are dangerously low. If they appear yellow, that suggests jaundice, often linked to liver dysfunction or red blood cell destruction. These color shifts are not cosmetic. They reflect circulation and oxygen delivery in real time. Excessive drooling, repeated swallowing motions, or sudden difficulty swallowing may indicate oral tumors. Dental abscess rupture, toxin exposure, or obstruction in the throat or esophagus. A brachycephalic breed already has airway vulnerability. Swelling or blockage increases risk dramatically. Uncontrolled heavy panting in a cool environment, combined with weakness or collapse, can signal heat stroke, cardiac failure, or systemic shock, even indoors. Brachycephalic dogs can overheat faster than owners expect because their heat dissipation mechanisms are limited. Here is the line I want you to remember. Some symptoms are informational. Others are action signals. Behavioral shifts that persist for days invite evaluation. Neurological changes that appear suddenly demand urgency. Your Shih Tzu does not exaggerate. It does not fabricate symptoms. It responds biologically to internal disruption. The nervous system is the final layer where all other systems converge. When coordination, consciousness, breathing rhythm, or gum color change abruptly, the body is no longer compensating quietly. Throughout this series, we have moved from behavior to breathing, from metabolism to neurology. What connects all of it is this baseline awareness. The most powerful tool you have as an owner is not medication. It is observation. Know your dog's normal sleep pattern, normal breathing rate, normal appetite, normal energy, normal gum collar, normal gait. When you know the baseline, deviation becomes visible. Shih Tzus are resilient, affectionate, and deeply bonded to their humans. But their small size and anatomical traits mean that early signs can progress faster than many expect. Early recognition changes outcomes. You do not need to become a veterinarian. You need to become attentive. When something feels different, and that difference persists or escalates, trust the data in front of you and seek professional evaluation. Calm awareness saves more lives than panic, and far more than denial. Your Shih Tzu cannot explain what it feels, but its body is always speaking. The question is whether we are paying attention.